thank you for joining me today. We're at Lynch Primary Care, where I have Dr. Lynch and Dr. O'Hare here today to answer a few questions about COVID-19. These are the most frequently asked questions by patients around the office. Dr. Lynch, Dr. O'Hare, thank you for being with me today.
Joe, thank you. Appreciate you taking the time to do this. Dr. O'Hare and myself are coming from Lynch Primary Care once again, addressing some of the many questions that have come up regarding COVID over the past few months. And there's lots of good information and some misinformation out there. So we thought it was a good time to sort of update the folks at Lynch Primary Care. So thanks for tuning in.
Okay, so our first question today is, how do I know if I have COVID?
Generally, you're going to know one of two ways. Either somebody's called you to let you know you've been exposed, a family member, a work colleague, etc. That's how a lot of people find out they were exposed. And then, of course, if you have COVID, oftentimes you are symptomatic, with the predominant symptom being cough, fever, headache. Some people get loss of smell, loss of taste, muscle pains, typical flu-like symptoms. In fact, it's virtually impossible to tell the difference between COVID, bad cold, or flu. You really need to get tested if you have the symptoms of COVID, or quarantine, one of the two. Let me also say and make it clear that 40% of people that test positive for COVID are asymptomatic. 40%. So 40% are asymptomatic, 45% it's a nasty cold, and then another 15% get sick enough that they end up either in the emergency department or even a smaller number in the hospital. And as we know, 1 or 2% of people die from complications of COVID.
What should I do if I'm exposed?
So, great question. So if you're exposed, the first and foremost, you need to quarantine. That's most important. And then secondly, you probably should get tested, if you want to know. And depending on the test results, and we'll talk about the different testing in just a little bit, but let's say you do end up testing positive, then you need to follow the protocol where you need to quarantine for the minimum of 10 days. And at that point, you must be asymptomatic, for 24 hours before you can break quarantine.
What if I become symptomatic?
Another good question. So if you become symptomatic, again, you can choose just to quarantine for the full 14 days if you can be home, work from home, and not have to get out. If you do need to get tested, you can get tested at that time. I'm going to go back just a little bit to the exposure. If you are exposed, you should wait at least 3 days before you get tested for that. But if you become symptomatic, you can get tested right away. So again, if your test results come back positive, the quarantine is you need to wait a minimum of 10 to 14 days. At that 10-day mark, you must be symptom-free for 24 hours.
And I should also say, by the way, if you are exposed and you have the illness, if you know you have COVID, you should have a pulse oximeter at home. Yes. To measure oxygen level, because that's actually the key finding that would drive you maybe to go to the hospital versus not.
Which test should I get?
So good question. So there are two main tests that are out there that will test to see if you actually have COVID currently. One is the PCR test. That is the best test that there is out there. The problem with that one is A, you got to get an appointment, and B, it can take a minimum of 2 to 3 days. Sometimes we're seeing 4, 5, and 6 days to actually get the results. But we know the results are accurate. There is also the rapid antigen test. This is rapid. It's great. It's 15 minutes. If it's positive, rest assured you have COVID. The problem is there's a lot of false negatives with the rapid antigen, which is why Dr. Lynch and I always recommend getting the PCR test, maybe in addition to the rapid antigen if you choose that route. And then there is a third test, and this is a test to see if you've had COVID, you had the exposure to it, if you had the actual disease. It's retrospective, so it's looking back. And that test is a good test because of what it's looking for to see if you actually have antibodies. The key with this one is you need to wait a minimum of 2 weeks before you get tested. You need to allow your body time to build up the antibodies so that we can actually see it accurately in the test results. So bottom line is, if you're exposed or you become symptomatic, you need to quarantine. And then if you choose to get tested, PCR is the way to go.
Dr. Lynch, what treatments are available?
Well, let me do the different tiers. So there are There are no preventive treatments available. There's no pill, there's no hydroxychloroquine or Plaquenil or antibiotics that prevent COVID-19. There is no such thing. So we know now that preventing it is really social distancing, wearing a mask, etc., the things you hear about on the news day in, day out. But no pills that prevent COVID-19. Now, if you have mild COVID-19, you do the same thing you do with any nasty cold or flu. You stay well hydrated, you take Tylenol and either Advil Relief for some of the aches and pains. If your chest gets very congested, you might take Mucinex. But those are the things you do for mild COVID. And the majority of people that have symptomatic COVID, it's a cold or flu-like thing. Now, for people that are becoming sicker, more the mild to moderate COVID-19, there's evidence that monoclonal antibodies and infusion of antibodies tends to help. It's very expensive. It's not readily available. I almost hate to say it because it's not readily available for folks at this point. If it becomes more readily available, it would be something that we would prescribe at some point, but you'd have to go to an infusion center. And generally, infusion centers don't want people with COVID in their infusion centers. So it's a tricky thing. Now, last year, the moderate to severe people that are in the hospital, there's pretty good evidence that some of the higher strength steroids, dexamethasone, along with remdesivir, that combination tends to have shorter hospital stays, not quite as sick, shorter mortality. Also convalescent antibodies, and that's so antibodies from somebody that's recovered from the infection. There's some evidence that decreases mortality also. The numbers are not all that impressive, I will say. If the mortality from somebody with severe COVID in the hospital is in the 24% range. In this study, it drove it down to 21%. So there's a 3% improvement. It's not dramatic, but yet any improvement, any better outcome we'll take.
So we've all heard the news and we know the vaccines are out. When are they going to become available?
So yes, they are here, which is very exciting. The Pfizer vaccines began being administered about 2 weeks ago, and then the Moderna was rolled out last week, and I think the shipments arrived. And the even better news is that Dr. Lynch and we both received our first vaccine this morning, so we are super excited about that. So Pfizer and Moderna are here. There are 2 more that are supposed to roll out in January, February, and there's at least 12 kind of in the pipeline, that will become available in the early spring, late winter as well. So super excited about that.
Who will get the vaccine first?
Well, this has been all over the news, so and it's pretty clear that the healthcare workers, the docs, the nurses, the techs, the maintenance crew in the healthcare systems are first in line. Also, the people at the assisted living facility and nursing home, the patients and the staff workers there are in that top tier. And next in line is going to be the 75 plus crowd as next. We're pretty certain that that's what's coming next. And then following that, unclear at this point. I think it's pretty much all others. But the question that most of you are asking is, what about me? When am I getting my vaccine? And we don't have a definitive answer as to for the general public, but we think that's coming in the next few weeks.
Have the vaccines been too rushed?
The quick, easy answer is no, absolutely not. What they have done is they've been able to remove any of the unnecessary delays that sometimes take place with vaccine development. But rest assured that the clinical trial phases 1, 2, and 3 were carried out with the same scientific rigor as they have been for many, many years for all the vaccines that we have. And again, most people would ask me, you're a doc, aren't you concerned that these are rushed and will you get the vaccine? And like I already said, we were able to get ours this morning. So whenever it's available, we hope everybody will get their vaccine.
Should I get the vaccine?
I think really, unless you have an absolute contraindication to getting the vaccine, you should get the vaccine. The benefit clearly outweighs the risk involved, and these are very effective vaccines. And remember, vaccines have been around, some form of vaccine has been around for over 1,000 years. Even the Chinese were doing vaccines many, many years ago, hundreds of years ago. And if you look at polio vaccine and tetanus and rabies and the more common, the MMR vaccines, we've eradicated or almost eradicated most of these diseases just with vaccines. Vaccines are incredibly important and valuable. And so the short and long answer is yes, you should get the vaccine.
What side effects should I expect?
So from the clinical trials, what we've come to find out is the side effects are going to be probably a little bit worse than when you maybe get your tetanus. Your tetanus, you're a little sore and also probably a little bit worse than maybe the flu. After you get the flu vaccine, you have the cold symptoms. Probably going to be more on the lines of the Shingrix vaccine side effects if you happen to have had the Shingrix. And what you can expect are headache, fever, chills, muscle ache, joint pains, overall fatigue. But again, in this situation, you look at the risk and the benefit. I mean, the benefit of this vaccine is huge. I honestly felt like that was history in the making this morning when I got my vaccine.
Same here.
I got good chills, not fever chills. I got good chills when I got my vaccine. So certainly the benefits outweigh the risk of side effects in this case.
And I'll chime in one more thing also. If you look at the data for the Pfizer and Moderna trials, 35,000 people between those two trials actually got the vaccine. And there were no reported serious adverse events in 35,000 people. Now that doesn't mean, they didn't have some typical vaccine side effects, that the achy arm and fever for a day, that kind of thing, but no serious adverse events. And that's typical of most of these vaccines that I mentioned earlier.
Yeah.
What about long-term side effects?
Long-term side effects from vaccines are exceedingly rare. The risk of death from COVID-19 infection is around 2%. The risk of a serious adverse event from a vaccine is probably less than 1 in 10,000, but let's say it's 1 in 10,000. If you do the math, you're 200 more times likely to die from COVID-19 than you are to have a serious adverse event from a vaccine. So, you never say never with vaccines. Could you possibly have longer term side effects from vaccine? It would be a rare event. And it makes sense for really virtually everybody to get the vaccine.
Dr. O'Hare, what should I do about routine health issues?
So good question, and basically it comes down to everybody's different. You got to look at the risk and benefits. I'll give a few examples. So let's say you're due or overdue for that colonoscopy for colon cancer screening. And let's say in the past you've had some polyps, and some of those have maybe been precancerous polyps, or you have a strong family history of colon cancer. You may not want to push that off too much longer. And rest assured, if you do go in for that colonoscopy, the physicians, the staff, facilities are doing everything that necessary to keep you safe during this time period. Another example for the ladies, let's say you're due for that mammogram and you had your annual mammograms, no history of abnormal mammograms, no significant family history of breast cancer. That mammogram can probably wait another 6 months or so until hopefully this pandemic clears up. If you have blood pressure, hypertension, and let's say through the holidays you've seen some fluctuations, some elevated numbers or possibly even some lower numbers, and you've become symptomatic maybe, that shouldn't wait. You should certainly reach out to us. We need to discuss that. And the same for our diabetic patients. Let's say you've seen an elevation in your glucose numbers. We need to address that. And we can use telemedicine. We have FaceTime, we have the phone, we have a new program called Doximetry that we're using, to do telemedicine. We're only a phone call away, of course. But if we do feel that you need to come in, if we feel like you need to come in and you as a patient feel like you need to come in, please know that we're taking all the reasonable and significant precautions here in the office to keep you safe, to keep us safe, and our staff safe as well.
Thank you both for joining me today. This was great information. I'm sure your patients will really appreciate it.
And Joe, once again, thank you for taking the time to do this, and we appreciate the patients hanging with us through this video. Appreciate any feedback you might have, any questions or comments. We look forward to that. And please look for emails coming from us in the next few months as we get more information on the vaccine rollout. We will try to keep you informed with short blast emails. And lastly, happy holidays from Dr. O'Hare and myself, Lynch Primary Care, and look forward to seeing you all next year.
Happy New Year, everybody. Cheers to 2021.